Daring Abroad, brought to you by Equity.
She went to Australia for studies in healthcare.
I had a passion in women and health.
Now she runs her own healthcare recruitment agency.
Jobs have become very scarce. It's very competitive now.
And she's investing back home.
I'm a developer now in Kenya. Oh, karibu, Chamwada. How are you? Karibu, karibu.
Veronicah Mumira grew up in Mombasa County. She attended Loreto Convent Primary School for her early childhood education before joining Star of the Sea Girls High School in 1995. She says as she studies, she always knew healthcare was in her future.
I finished my high school in 1998. I started working with my parents because my parents are in the medical field. My dad is a doctor, my mom is a nurse. So I started working in their practice, their clinic in Likoni. And that's where I started my career in the healthcare.
This passion saw Veronicah leave Kenya for Australia in 2001 and joined Notre Dame University for a bachelor's in nursing science.
When you go to Australia, to the Western world, everyone thinks it's a milk and honey. You know, you land there and you already start earning big bucks. But when I started my journey in Australia, I got a job in the hospitality industry as a housekeeping. So, you know, did those odd jobs of cleaning, housekeeping. That's how I started off as as a university student to try and, pay my bills. It's not easy, but we made it.
Despite the difficulty, Veronicah was able to balance work and studies and eventually graduated in 2004. Immediately,
I got a job with the Department of Health, Western Australia. So I started my journey in Bentley Hospital and I did mental health and general nursing. So for a year. From there, I got an opportunity to work in Sir Charles Gardner. It's one of the biggest tertiary hospitals in Western Australia.
But for Veronicah, this was only the beginning. She decided to go back to university for a postgraduate diploma in midwifery at Curtin University. And it was after this that the idea of starting her own company first came to her mind.
So I was doing agency work because you do a full-time job with the government, but obviously you want extra bucks. So I was doing agency. So agency means you work with different agency casual, and they send you to different locations. So I did that for around 5 years, and I thought, what can I do to be like an agent? And that's how Auscare Group was born in 2009. It's a staffing agency, it's a recruitment. We do send staffing to the healthcare industry. So we do send the registered nurse, enrolled nurses, chefs, cooks, anyone who can be able to keep a hospital or aged care running.
Hello Alex, come in. So this is our business support officer, as Elizabeth.
Hi, how are you? Good. Yeah, pleasure to meet you.
You too.
Yeah, thank you. Auscare is divided into 4 areas of specialization. One important area is provision of healthcare services for the disabled.
We are a registered National Disability Insurance Scheme, so we have been chosen with the department so we can be able to look after the loved ones. So we can offer support like carers. Carers are people who come to your house, they help you with your, the day-to-day activity like showers.
Veronicah has employed 400 people. They range from professionals to support staff, and workers of Kenyan origin form about a quarter of the workforce.
We have certain selection criteria. You have to tick the box. You have to have a minimum experience in some areas. Like, obviously, if you're a registered nurse, you have to be registered with the department, with the board, to be registered. If you're a kitchen hand or domestic cleaning, those are the jobs where it's more experience. So we look after a lot of Kenyans who, especially when they're new in the country, they'll come and apply for those jobs.
So you can't just land and get a job in that area?
No, you can't just land and expect to get a job. You have to have a little bit of an experience.
Auscare also undertakes training of aspiring healthcare practitioners.
So we do offer national accredited courses and non-accredited courses. So when I say accredited courses, are specific courses which has been quality assured with the government, the vet sector, vocational education. We can offer those courses and they are accredited. So when you have those qualifications, you can be able to use them across Australia and New Zealand.
Veronica has been successfully running her business since incorporation, and that is not all she has passion for. She decided to diversify and venture into the real estate business.
We do development in Australia. That's another side business we have. We develop properties in Australia. We do rental and selling of properties.
Veronica is expanding her real estate business to Africa. And what a better place to spread her wings to other than her motherland, Kenya.
Africa is calling, obvious, Alex. They say, you know, people are coming to Africa to invest, and the Kenyans are going out of Africa. So, but now the diaspora market, or the people of diaspora, are coming back to invest. I have a passion to give back to Kenya. So the development we're doing is an apartment, and not just an apartment, very contemporary Australian feel. As you can see, this is what we are looking at. The house, which we did, something which would look like this. It is an apartment, 28 apartments. It's a 3-bedroom, 3-bathroom, and each apartment will have a servant quarter.
Through this project that is known as Georgia Apartments, Veronica hopes to create more job opportunities for the Kenyan youths. It is expected to be completed by June 2021.
It's along only 2 minutes walk from Mombasa Malindi Road. It is within the Severin Beach Hotel around Chams area. So it's only 5 minutes walk to the beach, the Severin Beach, public beach over there, a beautiful beach. The higher you go, the views of the ocean, the higher dollar you pay. That's the normal way around the world with real estate. So we are targeting the middle class to the high-end clientele. So we are looking at between 16 million to 20 million. This is just an off-plan prices, but obvious when we have the showroom, you know, things will, you know, the prices will differ because this is just the off-plan rates.
But this is not all that Veronica has in store for Kenya.
What I'm bringing back home to the skill of nursing, we're going to be venturing into the training side. You know, hopefully next year, we're looking at expanding our training organization. As I said, it's an RTO, it's a registered training organization. So my skills as a nurse, I'll be looking at bringing back to the Kenyan and supporting them. As I know in the healthcare industry in Kenya, things like manual task, manual handling, looking after your back. A lot of ex-nurses in Kenya, they've injured their back. So those are kind of things to bring back to Kenya.
In Australia, Veronica warns that shortcuts do not work.
In Australia, they're very stringent about their compliance. Auscare is an ISO 9001. We abide with the standards. We have to make sure we pay the superannuation. This is the funds we give to the government, 9%. So as an employer, I have to pay 9% superannuation. So superannuation is when you hit a certain age in Australia, you'll get your superannuation back. I think it's 65, you get your money back. So the employer will put 9%. Every money you earn, you get 9% put away with the employer.
There is also the challenge of running a business as a foreigner.
Initially, people, obvious, they question, a young girl, a dark-skinned person, how can she come and, take over, basically, in Australia? So that can be a challenge.
So Auscare is about what can I do to give back to Australia?
Veronica says that these challenges proved vital in her journey and helped her become the entrepreneur she is today.
There is an opportunity as a nurse, you land a job easily in Australia and throughout the world, I suppose, nurses. And some of the Kenyans, they migrate from Kenya. They've maybe done their diploma in KMTC or the university in Nairobi, but they have to come to Australia and do a bridging program, which takes up to 18 months. So they can go to different universities like Curtin, Murdoch, ECU, and other universities around Australia. They do the bridging program. When they qualify, they get registered with the board, and then they start practicing as a nurse in Australia.
And as we conclude Veronica's daring abroad experience, here is her advice on our Diaspora Bite.
Western world is not easy. You have to work hard and smart. Jobs are becoming very scarce. It's very competitive now. So all the Kenyans who want to take their kids to Australia, or people who want to migrate to Australia for greener pastures, you have to be very open-minded, because the things which you think it's gonna happen in a week, it's gonna happen in years.
Veronicah Mumira's story closes the year. We've enjoyed your company. Let's do it again in 2020, and we take this opportunity to wish you a happy new year. Enjoy your holiday.
Daring Abroad, brought to you by Equity.